Good afternoon. Let's see if this works. Yes. But that's to talk about being a doctor. And one of the most first things you know, or one of the first things I realised as I sat down to think about it was that there's no such thing as a doctor or the ordinary sort of doctor. There's a huge variety in medicine. Lots and lots of different ways you can do it. I have contemporaries of mine who have stayed in their hometown, gone to their local university, and now work as GPs in the same town, and really have basically built their lives around serving that particular community. But it doesn't always work like that. You can have quite a lot of options. I'm going to have to refer to this. I'm currently working as a consultant surgeon at the local hospital, which is a Great Western over there somewhere. But I went to medical school in Newcastle. I did 1 year as a hospital doctor in Gateshead before going to Glasgow as a lecturer in anatomy at Glasgow University Medical School, teaching anatomy to medical and dental students. After that, I went and did general practice in Sydney, Australia, before going to work in a missionary hospital in what was then called Zaire, is now called the Congo, the Democratic Republic of the Congo. After that, I came back and worked in the NHS in Durham before escaping yet again to go mountaineering in Nepal, before going to spend 4 months working in a missionary hospital in India, before going back to Nepal to make a wildlife film. I then came back to this country and worked for a year down in Chertsey doing surgery. I then found myself essentially unemployable. However, I got taken on by the army, and I spent the next 19 years in the army, where I worked in Aldershot, where I did parachute selection so I could serve with the parachute regiment. I served in West Germany, in Iserlohn, back in Aldershot with the parachute regiment. Then I went to work in Woolwich in London for a year, before going to Berlin for a year, before going back to Aldershot for a year, going to Cyprus for 2 years, going to Northern Ireland for a year, going to the Falkland Islands for 2 years, and then I got stuck back in Farnborough in Hampshire, and I was due to stay there for about 6 or 8 years, but it's a dreadful place, so I left the army. You see, you can get a wide variety of things you can do. Huge variety. Now, the basics of medicine. First of all, it's a 5-year university course, right? And it's not easy to get in. Providing you can get in and you pass the medical 5-year course, you then do 2 years in what's called a foundation course, where you get told to do this job, that job, and the other job. At the end of that time, you can go for speciality training, which can take up to 15 years. Right? By which time, you're getting really, really old. Okay? You're pushing 40, which might not be seen much to people like me, but to the students amongst us, that's very old. Okay? There's lots of different options you can do in speciality training. I'm a surgeon. I'm a general surgeon who works in emergency medicine and colorectal surgery. The other options are orthopaedic surgery. You can do anaesthetics. You can do paediatric surgery. You can do ophthalmology, ear, nose and throat, plastic surgery, neurosurgery, cardiothoracic surgery, obstetrics and gynecology. And then there's all the other medical specialities, like cardiology, gastroenterology, dermatology, paediatrics. You can even do ITU, radiology, palliative care. You can even be a psychiatrist. You can serve in the military, as I did, or you can go and serve overseas, as I did briefly. There's lots and lots of different options. The other point to be mentioned here is that going to do medicine isn't something you necessarily do straight from school. Okay? At any one time, about a third of the junior doctors at the Great Western have done other degrees or other jobs. I was talking to one of our junior surgeons the other day, and he did a degree in physics and philosophy. Right? Utterly bizarre, at Durham University, before going to be a management consultant in London, before getting totally fed up with that, and then doing medicine. We've had people who've done law degrees, people who've been laboratory technicians, people who've done all sorts of different degrees and all sorts of different jobs before deciding that they want to do medicine. So if you don't get into medical school straight from school, it's not the end of the world. And the other point to mention is that when you get your medical degree, that is not the end of it. There are always postgraduate exams. Right? If you're lucky, you've finished doing those before you're 30. If you're not, you're still doing them when you're nearly 40, like I did. Dreadfully depressing prospect. Right, okay. It's a demanding course, right? That's the first thing we've got to say. Academically, very demanding, both before and during university. It is not easy. You have to be good to get in. It's very competitive, and you've got to be top-notch academically. My advice always is if you have to really work very hard to do well at school, then perhaps you should think of something else, okay? Because the step from school up to university is a big one. It's academically very demanding. If you want to get in, then getting top grades in your exams is not good enough, right? Because everybody's got top grade in their exams who applies to do medicine. You also need extracurricular work. You need to be captain of the school sports team and things like this. And you also need to ideally demonstrate a commitment to medicine by doing some volunteer work in an old folks' home or at a hospital or something like that. Okay? It also helps if you're female, because most medical students are female. Don't ask me why, but they are. It's also financially demanding. 5 years, £3,000 a year for fees is £15,000. You then have to buy accommodation and clothes and books, and if you want to eat, you've got to buy food, and it all becomes quite expensive, right? Now, this is something not necessarily for the student to think about, but it's certainly something for Dad to think about, because he'll probably be paying for it, right? It is demanding work, very fulfilling work, deeply satisfying, but it is very demanding. It's demanding intellectually. As a surgeon, it's demanding physically and also emotionally, right? Hard work. Currently, there is a legal requirement to be perfect, right? You can't make a mistake as a doctor, otherwise people will sue you, right? The hours are often long, the responsibilities are onerous, and there is a requirement for what's called CME, which is continuing medical education. You have to carry on studying throughout your life. You're not allowed to get away with thinking, well, I've done it, got my exams, I can relax. Not allowed to do that. You have to carry on studying and going to lectures and courses and all sorts of things. It's actually quite stressful. In the last 18 months at the Great Western Hospital, we have had 4 junior doctors off with stress-related illness. Okay? It is demanding. It is challenging. And there are people who go in for this who simply aren't built to cope with that sort of stress. I actually quite enjoy it. It keeps me awake, gives me a bit of things to do. But there are a lot of people who don't like taking the responsibility. My day job consists, for example, of cutting people open, reorganising their insides and then closing them up again. And that's quite a responsible job, and it's quite stressful. And it's not, medicine is not for everybody, okay? And I think you've really got to think about it. And it's not just for anybody either. It's really a very demanding work. I hope I've put you all off, okay? It's very fulfilling work and there is a lot to it, but you've got to be suited to it temperamentally and academically. Okay? And I think your parents and you and your supervisors have got to be honest in their assessment. It's also changing a lot. The curriculum, both at medical school and also for postgraduate training, is changing. The way they do the examinations are changing. There's this dreadful thing called the European Working Time Directive. I don't know how much you know about this, but currently the average junior doctor will work between 55 and 65 hours a week, and the proposal is to cut it down to 48 hours a week. This is not too much a problem if all you're doing is book work or seeing patients in a clinic, but if you're in a craft speciality like surgery, where your ability to do the operations depends on lots and lots of practice, then it's a big blow and it's a big problem. And you might think, well, why don't people just ignore it? And by and large, they do. You know, people come in their days off to help doing operations and do lists. But it's illegal. And if anything happened, the hospital is in deep trouble for doing it. And it's something that's an ongoing battle to try and get across to people that if you want a surgeon who's going to be able to do the operation properly, you've got to arrange so they can get lots and lots of practice. Okay? There's a thing called the Modernising Medical Careers, which is changing the whole structure of the way the medical profession is organised. They introduced it 2 years ago. It was a total disaster, and they've gone back to the drawing board and they're trying to produce something better. There's licensing. Up until now, you got your registration with the General Medical Council and you were free to practice for the rest of your life. That's all going to change sometime in the next 4 or 5 years, and you're going to have a license to practice in this country as well as GMC registration, and you're going to have an annual appraisal, and every 5 years you've got to get revalidated. Someone's going to have to sit down and say, can this guy carry on? I think of my consultant colleagues, and you know, I don't think anyone's going to turn around and tell them they can't. But that's the proposals facing us. The other point to make about it is that medicine involves teamwork. If I do an operation, I might be doing the operation, but I need a staff nurse, a scrub nurse who's trained. I will need an anaesthetist who's trained. We need operating department assistants who are also trained, and there's all the backup staff as well that we need before we can actually do the work. Right? So teamwork is the important thing. And teamwork is comprised of professions allied to medicine. All right? Which is a whole load of them. One of the more interesting facts about the National Health Service I found the other day was that the world's biggest employer is the Chinese Army, the world's second biggest employer is Indian Rail, and the world's third biggest employer is the National Health Service. Okay? 1 in every 23 people in this country works for the NHS. Okay? It's a huge number, getting on for well over 1.25 million people. It's quite a nightmare, really, in some ways. But these are why you need so many, because you need all these sort of other healthcare options. Right. Now, I don't actually know a huge amount about any of these jobs, so I went asking around. Okay. Nurses. 2 kinds of nurses, I'm told. There's what's called healthcare assistants, and there's registered nurses. The qualifications you need to be a healthcare assistant, as far as I can work out, are to be warm and breathing. There are no academic qualifications needed. As long as you can read, write, and do sums, you're okay. Training is given on the job. To be a regular nurse, you normally need the equivalent of A levels, which is either intermediate or advanced ICCE. And it's in a diploma or a degree course for 3 years. And nursing, again, has got a huge number of different options. You can work on the ward, you can work in a GP practice, you can be a community nurse, you can specialise in stomach care. You don't want to know what that is. If you want to know, ask my wife, because you can be in palliative care, you can be an ICU nurse. There's a huge number of variety of different things you can do. Physiotherapist. Very useful if you're an orthopaedic surgeon, because he's the guy who gets the patients moving again. To do that, you need A-levels or advanced, because you're going to get a degree at a university. Occupational radiographer, rather. Radiographer, people who take the x-rays. To do a radiography, you need A-level equivalent. And then again, it's a 3-year degree course. These are highly trained people. They're not just, peons and serfs. And their skills and training are necessary for medicine to work. Okay? Because medicine is not just about doctors, it's about the whole of the team. Operating department assistant, best people in the world. To work with these, they're not actually that difficult. GCSEs or AS levels will get you in to be an operating department assistant, and you're the people who actually make the operating department work. You can be an occupational therapist, which the sort of people who make sure that the sick and elderly can go and still live at home. They do all that organising and sorting out. Laboratory technician, you need A-levels, you get on-the-job training, and you end up with a degree. Very important people, because they're the ones who help make diagnoses. You can be a phlebotomist. This is someone who takes the blood samples. Great fun if you like sticking needles in people. Okay? And again, no training there is required. No qualifications are required, because you get on-the-job training. Clinical support worker. This is a general trade of people who do all the dog's body works. Everything from porters to blood bank technicians and this sort of thing. A paramedic, the people who work in the ambulances, these two. Normally you need some kind of academic qualification. You get on-the-job training, and the guy who goes out in the ambulance and does the initial primary treatment of the patient. Okay, quite a responsible job. And my estimate of these guys, because I see a lot of their handiwork, is that they're actually pretty good. They do a good job, and it's quite a worthwhile job. You can be a dietitian to make sure the patients get the right food in the hospital. The diabetics and celiac disease and all this sort of thing can actually get an appropriate diet. To be a dietitian, you need a degree in dietetics. To be a pharmacist, you need a degree in pharmacy, and therefore you need to go to university. You got medical secretary. I couldn't function without my secretary. I don't know what I'm doing from one week's end to the other. And it's the secretary who says, oh, by the way, you've got an operating list tomorrow. Oh, yes, good point. This sort of thing, who organises it, does all the typing, and deals with all the patient questions. There's an et cetera at the bottom, which includes possibly the biggest growth industry in the NHS, which is clerical staff, administrators. If you like, sit in a computer, punching keys all day, then that's the job for you. Okay? As far as I can see, you don't need any qualifications for it at all. All you need to do is the ability to sit in meetings. I've just spent 3 hours this morning in meetings, and I hate meetings. But there are lots of opportunities there. All right. So that's briefly life in medicine. Okay? Itself is very demanding, both academically and in every other way. But it's a very satisfying, and if you've got the temperament and the skills, it's a brilliant job. Brilliant way of serving the Lord, basically, by doing that. But there are lots of other options available in the medical team. The only other point I'd make is that it's not actually a hugely friendly environment for Christians, okay? Particularly in the military. Very unfriendly in the military for Christians. There are Christians who do this, who are involved in all these things, but it's not a terribly friendly environment. So that's something you've got to be considering, something you've got to be aware of, that you will be challenged and put on the back foot, and you can end up getting into all sorts of trouble. Yeah. You find that as a Christian doctor, you tend to be left out of a lot of things that go on. I remember when I was in the army, one of my consultants telling me that I had to get sorted out the amount of time I was spending on my religion and my family. Okay? He made it quite clear that he wasn't telling me I got to cut it down, but he expected me to take the hint. So I didn't. Okay? And did very badly. Got a very bad report. But that's the sort of problems that you can face.